So, as Emma said, I'm Mel Chisholm. I'm one of the directors in the vaccination program, helping to roll out the vaccine to the whole of our community across the state. Before I get started, though, I would also like to acknowledge the traditional owners of the land on which we're meeting today. For me, that is the Wurundjeri people of the Kulin Nation, and pay respects to elders past, present and emerging. I guess just building on the welcome and those fabulous ads that you showed up front, Emma, the time is now. The time is now to get vaccinated. It is gathering pace. We're picking up the numbers, and I want to thank VCOSS for being an amazing partner in this process, without which we could not be reaching as many people as we are at the moment. We don't have that reach out into the community that many of the partner organisations and stakeholders have. And VCOSS has put together a fabulous campaign, which you'll hear more about in a little while. So just onto our current program update then. So key to this slide is really that vaccination is not slowing down during this outbreak and is certainly not slowing down during our lockdowns. It is actual fact ramping up. And as was announced by the Premier on Friday, we're actually setting ourselves a target of reaching 1 million doses over the next 5 weeks, which is not insignificant. That's 200,000 doses a week on average, and also looking at, on a daily basis, 25 to 30,000 doses. So pretty significant ramp up. And we have got that supply coming in from the Commonwealth over the coming few weeks, which I'll get to later in my presentation. So I guess just to back up, I guess vaccination is still definitely one of the 5 reasons to leave home, and would be encouraging everybody to think about how we promote all of the sites and the access that we do have to vaccines at the moment. Definitely not a metaphorical door like New Zealand's program, definitely some real doors there for us to open. Sorry, just going to grab a drink, 1 second. So, as we said, getting the vaccine is one of the 5 reasons to leave home, but I guess it's always good to be thinking about our COVID-safe messaging more broadly in our work with stakeholders and our partners. We really need to continue to think about socially isolating if need be, wearing a mask, thinking about washing our hands still, scanning our QR codes, and obviously getting tested if you think you have symptoms. In terms of getting tested, our numbers are pretty good, sort of averaging 25 to 30,000 tests a day at the moment, but we'd like to see that a little bit higher, particularly in the context of an outbreak. So we'd really encourage people to get tested if they have any symptoms or have been to tier 1 sites. In terms of our vaccine doses, we're doing well, as I said. So 25,000 doses were delivered yesterday, and we're averaging somewhere between 20 and 30 doses a day most of the time, which is awesome, but we want to see that ramp up even further. In terms of the state-based system, we've administered almost 2 million doses, which is an amazing achievement. And I just want to thank everybody who's been rolling up their sleeves and encouraging their partners and community to get vaccinated. In terms of the national number, a really exciting milestone was hit. We've now passed 15 million doses nationally, which is amazing. And so that means Victoria, I think we're actually very close to 4 million now in terms of our doses across the state, including our primary care partners and the state-based system. This slide just talks a little bit more to the doses and comes back to that number that we've been talking about. So at least 45% of the Victorian community has now had at least 1 dose. So you know that the Premier and the Prime Minister have been talking about this sort of trying to hit this 70% target and then the 80% target in order to think about reducing lockdowns and reducing restrictions and making our way out of this pandemic. So we're 45% in Victoria, which is amazing, who've had their first dose, and 24% of people have now fully vaccinated. So we're really starting to make strides now up towards those numbers. So really well done to all of you. The graph on the left sort of shows where we're up to in terms of age and gender. So you can see that at the top of the section there, you can see that higher age groups are more likely to have had their first dose and be fully vaccinated, which makes sense, of course, because that's where we started in terms of eligibility and applying that risk-based lens to those who are more susceptible to get COVID, but also to become seriously ill with COVID-19. So we've got a bit more work to do in the lower echelons there, but we're certainly starting to think about how we can work more with youth and youth organisations, and also now just having opened up eligibility for AstraZeneca to 18 to 39-year-olds. So just in terms of that eligibility, and it is, I'm sorry to say, still a little bit confusing, and apologies for that. I'm really hoping at some point we can really just open up and say, come one, come all. And once that supply really does start to kick in, we can definitely do that. But at the moment, we still do have some restrictions on who is eligible. It is starting to get a lot more though. So I think since we last spoke to you, the key ones probably from this slide are that we now have Pfizer approved for 12 to 18-year-olds. So young people aged 12 to 15 with an underlying medical condition or with a disability are now eligible to get vaccinated at either a GP or a state-based clinic. And Aboriginal and Torres Strait Islanders 12 years and older are also eligible to get vaccinated. The other one would be people that are pregnant, who I think is also new since the last time we would have talked to you. So I guess just to flag also that people aged 18 to 39 can now choose to receive the AstraZeneca vaccine through a doctor or community health service if they choose to. You can go to our website and also to the eligibility checker to have a look at the current eligibility requirements as well, and maybe one of my team can pop it in the chat for you. So this just talks a little bit to the supply that is coming down the line. So as you know, this is a Commonwealth-run program. We are working closely with the Commonwealth to try and get as many doses into the state as we can to try and meet the demand that we know is there. And you can see through from August to November, December, that we have got additional doses coming online, coming both into the state system, which distributed through our 50 state-based vaccination clinics, but also into the primary care sector. So coming even in September and October, you can see the doses are actually starting to really ramp up. We've also got Moderna coming into line in terms of the primary care settings, having Moderna coming online from September. Pharmacists will also have Moderna and AstraZeneca. And a number of pharmacists have come online just this week to start delivering AstraZeneca. We then have, so you can see the total doses allocated down the bottom. We're really starting to get big numbers through of Pfizer, AstraZeneca and Moderna towards the end of the year. So I guess the key message here really is that supply is coming. Let's keep the demand going and make sure there's plenty of arms ready for when the supply does come through. And in terms of where you can get vaccinated, there's now some really great options. So we have a whole range of opportunities for people to get vaccinated, including, as I've just said, pharmacists coming on board this week. I think around 600, maybe don't quote me on that, but I think there's a lot of pharmacists coming on board. We've also got our main 9 hospital hubs and our 50 state-based clinics and practices around the state. We've got community health on board, obviously, through our C19 partners and others. We've got also the primary care doing an amazing job with all of our GP network, GP respiratory clinics, and of course, all of our wonderful Aboriginal community-controlled health organisations who are really ramping up their doses as well. A number of them now are doing Pfizer as well as AstraZeneca and really supporting the Aboriginal population to be, we actually have one of the highest numbers in terms of our state-based vaccination rates for Aboriginal and Torres Strait Islanders, which is really exciting. This just talks a little bit to the state-based, just showing how much coverage we have. So perhaps when we spoke to you earlier, the last couple of times, we perhaps had some gaps sitting in some of the areas, particularly the regional and rural areas of Victoria, but we really have worked hard to make sure we've got coverage across a lot of the state now. We're also looking at different options of delivery. So you'll know that we've just set up our Melton drive-through, which is going amazingly. I think there was only one booking left for the whole week this week in terms of that drive-through access. And we're looking at setting up additional drive-throughs in Wyndham, and also I think one in the southeast and potentially one in the north as well. We'll have more information about those soon. But just to show you, I guess, that we really are ramping up where you can get vaccinated and making it as easy as possible for everyone to access a vaccination. In terms of booking, you've now got sort of 3 options, I guess, in terms of booking a vaccine. So you can go through the portal, so the state-based portal, and choose from the drop-down menu of where you'd like to go, when you'd like to go, or you can still call the call centre and be assisted through that process, so someone can help you to find a booking, and that makes life a bit easier for people who are not sure where to go or where the closest site is to them in particular. What they're also able to do now is we're trying to track where the capacity sits in terms of the program. So where we know that there is sites available, for example, so yesterday I was looking at Wyndham City Council, and there was quite a lot of bookings still remaining in the system, both for Pfizer and AstraZeneca this week. So we've done a bit of a call out to colleagues in Wyndham to say, can you promote the Wyndham Civic Centre this week, because there's still bookings available. And the same thing happens in our call centre. They can look at where the capacity is and try and promote going to one nearby that they know has capacity in the system. The other way, obviously, is if you're going to a primary care setting or federally funded organisation like a pharmacy or an ACO, you do need to go through the eligibility checker. So that's the Commonwealth site, and they will direct you to the nearest appointments and available access. Now, let's get into some exciting stuff. And I'm so sorry, my background is usually this fabulous yellow, bright community immunity background, but because I've gone into Zoom, I don't normally use Zoom, I use Teams, so it hasn't come up automatically. So I'll show you some of this fantastic merch in a second, which you guys can get your hands on if you'd like to. So this is a fabulous campaign that we're really proud of, the Community Unity Immunity Together We Do Better campaign. We've done it in collaboration with VATSHO and with the Little Rocket Media and Aboriginal Community Group. And we've basically tried to work really hard with artists in the community to build a campaign that really promotes the call to come forward in that community. Provides imagery that's easy to recognise, which I'll show you in just a second, and also links to, I guess, really some strong messaging that really resonates with the community. We've got quite a lot of merch available, but I'll jump onto the next slide to show you. So this is just to show you what it looks like, and it's amazing. So this bright yellow one is what I've had as my background for the last few weeks, and it's really great to be able to promote it and be able to talk about it with whoever I'm speaking to. So encourage you all to do the same once we get you in contact with being able to download and look at it. Essentially, we looked at community, unity and immunity. What do those three words mean? They've all got specific meanings, I guess, in terms of why we chose those words. So our mob strength lies within our community. So the symbology there represents our people coming together at a time of adversity, because together we do better. The mob unites with care, compassion and love to help each other through these difficult times. That's where the unity sort of came from, and the unity of symbols holding hands and coming together again. And then immunity obviously is the driver of this campaign around trying to promote people to get vaccinated and build greater resilience across the community. We liked the idea of a shield on this one, and I think that really represents the idea of promoting that immunity and resilience. This is some of the merchandise that we've been putting together, and we've been starting to send this out to our state-based vaccination hubs now. We can put in an order for you, or I'll put the next slide up and you can see how you can access the information, but really encourage you to be getting hold of some and promoting it in your work with Aboriginal communities that you might do on the ground. So to order a pack, and you'll have this come through, I guess, I can send it through later, Ryan, if need be as well. But essentially we're looking at ordering for a number of organisations across the state. So please do let us know if you'd like to be included within that pack by the 27th of August. We'll pay for that, obviously, that's free to you guys. Now, I was just going to throw to a colleague of mine to talk a little bit in more detail about the next couple of slides. I'm hoping that Steve Clancy is on the line and we're able to throw to him. He has been the manager in our team, working really hard on a couple of the specific initiatives that I know you are interested in hearing a bit more about, including the DLOs. So I will hand over to him now for the next couple of slides, and then really happy to take questions, and I'll have a look at the chat as well. Thank you.
Thanks, Mel. Hoping everyone can hear me. So I was just going to talk briefly about group booking. So we have developed an online form for, at the moment, we've reserved the use of it for priority workforces. So aged care and disability sector providers can actually use an online form to request a group booking. We have staggered the release of the group bookings, and obviously in an outbreak, it's not always appropriate to have people jumping on buses and going to vaccination centres. But we have used the form to actually do mobile vaccination services as well. So that's in reach at workplaces mainly. So it's something that we have developed and will put out at scale depending on how we go with the outbreak. But it's something that we want to do to offer all kinds of groups, be it faith-based groups, community groups, but we are starting with those priority workforces. And as we go, we'll then look at also the mobile vaccination services as well. But we will prioritise those priority workforces as the start. So I think that's enough on group bookings. I think Mel wanted me to talk about the disability liaison officers. So there's 32 disability liaison officers that work in health services. They're embedded in the health service. We've had about 4,000 referrals to those DLOs. Each referral is basically a person that is identified as having a disability and needing help to access vaccination. So with those 4,000, we've had a lot of success. About 3,700 have actually been completed. We have about 200 people that are still working out different ways that we need to actually get them vaccinated. That includes things like getting in-reach, in-home vaccination. It can be quite tricky, particularly for those people in rural areas. So DLOs are working literally one-on-one with people with disabilities to actually get them vaccinated. The other thing is some people do need to get sedated to be vaccinated, so that's quite complex. We have about 70 people in Victoria at the moment that are waiting for that service. So we are looking at setting up specialist clinics, working with particular health services to make sure that happens too. I think what we'll do, I can see that the DLO coordinator email address is in there on screen. I'll also put my email address in the chat as well, so if anyone has any questions, they can actually get in touch with me too. I think that's it from there. Thanks. Oh, taxi vouchers. I think I'm going to talk about this too, am I? So we have got a trial going, folks. So I'm sure everyone on this call probably knows transport is a real barrier for many people trying to access vaccination. We have completed a 2-week small trial of having taxis available for those that have called through sort of 1-800 number. So when people call that number, if we identify that they are on government benefits, so that's basically any sort of benefit through Centrelink, they can actually be entitled to get a taxi to and from their vaccination appointment. You're probably wondering why you haven't heard much about this program. It is only been lightly promoted to specific target people, and when they ring up, if we identify that there's someone that has barriers to getting to their vaccination appointment, the agent who takes the call is trained to be able to actually organise a group book, a taxi voucher for that person. That is something that we will be looking at trying to scale up. As I said, we've done a 2-week trial so far. We're going to continue with the trial at a slightly bigger scale, and then hopefully we'll be scaling that up and we'll be able to promote it a lot more widely, and it is available all throughout Victoria. There are some parts of Victoria that aren't covered by 1-3 cabs, and so we do have another system through cab charge that we can actually cover the whole of Victoria. So it is a bit of watch this space, because we do want to make that more broadly available as we get more confidence in the system that we've put in place. So myself and Penny are working on these programs, and so we'll put our contact details in the chat, so that if you have any specific follow-up on any of those 3 things that I've just talked about, by all means get in touch with us.
Thanks, Emma. I think that's it from us. Thank you so much. I'll stop screen sharing now.
Thanks so much, Mel and Steve. Very much appreciated. And as someone who's going to get their second vaccination on Thursday, I'm pretty excited about that. I just wanted to, there's a couple of questions in the chat that I thought might be worth drawing specific attention to. I know the taxi initiative is fantastic. I saw Chris had a question there about initiatives to support people with disabilities to get access to vaccinations. Is that captured through the taxi program, or are there other initiatives, particularly, I guess, where people need to be vaccinated potentially in their homes?
Yeah, so I can take that one. The DLO program that I mentioned, that is our main driver in helping people with disability. We have also done quite a bit of work on accessibility at vaccination centres. So we've had 9 of our centres audited by an access specialist to make sure that they are accessible as accessible as they can be. So things like communication boards, hearing loops, those sorts of things have been filtered across our 50 sites now. We've used the audits that we've done from those 9 sites to actually look at some of the key things that we could implement across all of our sites. So we've done a lot of work around improving accessibility at vaccination centres, but we also realise for some people it is not possible for them to actually get to a vaccination centre. So those DLOs, as I said, they're working one-on-one with people to identify what their access needs are and how best to get them vaccinated. And for some people, it does mean that they have to look at vaccination in the home. And to do that, it's about finding GPs that are actually able to do that. In some rural areas, we have found that to be really hard. We're still working with that. And the DLOs are doing a really good job in working with the health services that they are employed by to look at the best options for those people.
Thank you very much, Chris. I can see, is your hand still up, or have you got a follow-up question, or is that about we addressed it?
Just a quick thank you to Steve and the team for organising that, and only to give just a little bit of feedback, and that's to say that the DLOs are heavily oversubscribed. They're a very popular initiative, so well done. And if there could be any more capacity into that area, that would be very much appreciated. But yeah, big thanks to you and the team.
Thanks, Chris.
Thanks, Chris.
Yeah. And I might just jump to one other question that I can see in the chat before we move on. And Trent from Local Learning and Employment Networks, I can see Trent's undertaking some work, probably along with the other outlets, in terms of looking at how to support more young people, students and young workers to get vaccinated as soon as they can. I suspect it's a bit of a $1 million question here about when do we think under 18s might be eligible, but I'll throw it open to you in case you've got any feedback around that.
Yeah, it's a really good question, and we do know that some countries are starting to think about this in terms of vaccinating young people, and we're looking at that evidence very closely. At the moment, I guess for us in this country, it's for 12 to 15-year-olds who have a medical condition, or for those who are Aboriginal and Torres Strait Islanders who'll be able to get access to a COVID-19 vaccine. And at the moment, it is only the Pfizer vaccine that's been approved for 12 to 18-year-olds. I can't say, I'm not sure when it will be opening up further, I guess. We are looking at that really closely. It is something that will happen in the future. But at the moment, based on the advice from ATAGI, which is the Australian Technical Advisory Group on immunisation, they're carefully looking at all of that evidence on the safety and effectiveness of the Pfizer vaccine in young people across the world. And at some point, I guess we will be able to open up. And particularly also we need to think about the supply side too. But we do understand that that's a group that's not yet come into the fore in terms of a more broad access. We're also starting to think about models of delivery in that space too. What could that look like? So would it be through a school-based program, or how would it be looked at? So there's a lot of work happening in the background is what I would say. And as soon as we know, you'll know as well. I would say that there's a whole lot of groups doing some great work with young people though. And one of our COVID ambassadors, for example, is YACVIC, who've been doing some great work in this space. We're also looking at working with the Huddle and a few others. So it might be worth touching base, Trent, maybe with us or with one of the team afterwards, just to kind of join the dots and see if we can work together on what you're doing as well around young people.
Thanks, Marianne, and a huge thanks to you and to Steve for a great presentation. I'm mindful of time, so thank you. And I know if others people, if you've got questions, pop them in the chat. If we don't get to them all now, we can follow them up later. So no, it's no issue at all. To keep things moving, I'm going to hand straight over to Marianne and to Brendan from Northwest Melbourne PHN. I hope you've got some popcorn ready as well, because I think there's going to be a short video presentation that I hear is pretty fantastic. So I'm really looking forward to seeing that. So Marianne and Brendan, I'll hand over to you. Thank you.
Hi everyone. Thanks for having us. Brendan, do you want to take it?
Sure.
The video?
Thanks, Marianne. Thanks, Emma. And thanks, Mel, for that amazing presentation. And hello, Mel. We used to work with Mel in PHN land. So shout out to the team at the department and everyone there who's doing such an incredible job and have been for more than a year and a half now. So I'm just going to share my screen, and I always panic a bit when I do this, but we'll see how we go. Everyone can see that? Yep. So I'd also like to acknowledge that wherever we are today, we are on Aboriginal land, and pay my respects to elders past and present. And also shout out to the Victorian Aboriginal Health Service and to all the Aboriginal health organisations who are doing so much to lift vaccination rates for Aboriginal and Torres Strait Islander people. And just to flag that also we will have a video featuring some Aboriginal people from our region as part of this campaign, which we'll be launching soon. So, Goodbye COVID. It's a multilingual video communications campaign featuring more than 60 community leaders from Melbourne, speaking in their first language in 20 videos, encouraging their communities to get vaccinated so that we can all say goodbye COVID. Today, I'm going to talk a little bit about why we need this campaign, the scripting and translation process, production and distribution. I know a lot of organisations out there are doing incredible communications work to contribute to this effort. So thank you to you all, and we're all doing a little bit to hit various groups of people. So hopefully you might learn something from what we're able to do today, but I know that many of you are doing fantastic work as well in this space. Marianne, do feel free to jump in at any stage, but we'll keep going. So why Goodbye COVID? Well, as we know, our region, which is Melbourne's inner north and west, is extremely diverse. There's almost 400,000 people in this region that speak these 20 languages at home. And more than 80,000 of these people speak English not very well or not at all. There's an article I linked here, we'll share it afterwards, but from Ben Shepherd at Mumbrella, he's just done this amazing piece on using data-led media planning to cut through to various audiences, what messages you need to be using, how you can target people. And he talks a lot about how we need to drive this from the bottom up. We need to split audiences into various cohorts, as I'm sure lots of communications people out there know how to do and know it's so important. But the Metro West region in particular is a massive prize if we can get it right. There's a lot of people in this region, a lot of diverse people in this region. And by using community to share these messages, we can make a big impact on vaccination rates. So scripting and translations. We wanted to use community, not celebrity. So Marianne and I sat down a few months ago now, and we looked at some of the campaigns that we like. The New Zealand one, which I saw at the start of this presentation, was one. Since then, we've seen fantastic campaigns from the Melbourne Symphony Orchestra, the Back to the Good Things campaign from VCOSS, which is incredible. And there's a lot of really fantastic work being done in this space. And I think there's this idea of thought leaders in communications, and often people think, okay, I need to use a celebrity. But there's some data coming out of the Melbourne Institute that says that celebrities don't necessarily work. They might result in a viral video that gets seen by lots of people, but does it have an impact on vaccination rates? I'm not sure it does. So local celebrities is what we're after. We're after people who are respected in their community, who are connected and have social networks and friend networks and family networks, who can share this message. And you know, there's not going to be one communications campaign that gets us to herd immunity if we can get there. It's a huge bottom-up approach. We wanted to sell the sizzle and not the sausage. Everyone has heard this phrase, I'm sure. And I'd like to point out that there are many different ways to cut this cake and to sell vaccinations, but we wanted to talk about the benefits, similar to VCOSS, the good things. I've seen a lot of photos of needles going into arms in the last 6 months, and we didn't want to do that. That might work for some people, but similarly, we didn't want to talk about the relatively minuscule risks or potential risks of developing a blood clot. You know, comparing this to car crashes or people at the MCG or getting eaten by a shark. I'm not sure about you, but when I'm considering my vaccine, I don't want to be thinking about getting eaten by a shark. Vaccinations are a personal choice. Everyone makes them for different reasons. They support yourself and your community. But we wanted to focus on the good things, why you would get vaccinated, why you would do it now. We wanted to future-proof our messages. We want them to be relevant in a year and 2 and 3 years' time. We didn't want to talk too much about eligibility in our campaign. We wanted to consider colloquialisms and simple language. Our campaign was constrained by budget, so we didn't spend time looking at specific barriers to vaccination in specific cohorts, for example. We wanted a simple, clear message that works well across communities and across age ranges. We tried to feature people in our videos from various genders, from various walks of life, from various age ranges. And then everything in the scripts was checked multiple times. So it went to the translation company and back and forth a few times. It got checked by independent translators. It got checked by our own contacts, and it got checked at the scripting stage, but also at the subtitles stage. So to make sure that the subtitles matched up to what people actually say. So I think now is a good time to just show you one of the videos. This is the English version. I'm hoping you can all hear this.
I'm getting vaccinated against COVID-19 because I want to protect myself and my loved ones.
I wanted to hug my mom and dad.
I want to be able to travel the world again.
I want to see my friends and family.
I want my kids to be able to go to school.
I want local businesses to stay open and give jobs to more people.
I want to reconnect with the world and live my life free from COVID.
When enough of us get vaccinated against COVID-19, life will be better for everyone.
I'm getting vaccinated to say goodbye to COVID.
Goodbye, COVID.
Goodbye, COVID.
Goodbye, COVID.
Goodbye, COVID.
Hopefully you could all hear that. I didn't see anyone frantically waving, so I assume you did. Now, I'd just like to point out that's the English version which we're using to spearhead the PR for the campaign. We think it showcases the diversity of our region and highlights some of the community leaders which were featured. But on the landing page, which I'll go into a little bit more detail in a moment, you can get this video in 20 languages featuring different people speaking their own language. You can download the scripts, you can quickly link and share and get resources in these languages. So production, and shout out to Matt Jasper and the Jasper Picture Company. I can see you in the audience there today, Matt. So Marianne and I led this project from Northwestern Melbourne Primary Health Network, but it's a huge job. There was the cast of around 60 people, and there's probably around 40 people who also contributed, including the amazing team from Jasper's Picture Company. But first up, we need that investment and buy-in from our organisations, leaders. It's not something, it's a small task. We're really lucky at our PHN that we have that, but it does take up a lot of time. It's, I don't think, overly complex to organise it. It's just a lot of detail. So we had a massive spreadsheet. We had regular work in progress meetings. We had columns saying who's responsible for what, who's chasing up this person, who's organising the hand sanitizer for the shoot, who's making sure that person A is at location B at a certain time. And we really spent a lot of time in the lead up before we even hit the studio, and that really paid off. I think we might have had 1 or 2 no-shows over the 3 or 4 day shoot, Marianne, but
we were pretty lucky. The Punjabis didn't turn up, but one of our executive directors helped out because I forgot that he speaks Punjabi. So we were actually able to replace them quite quickly. One of the things that Brendan was talking about, working with community was just brilliant, but it's some of the kind of detail we needed to make sure was like, are our Italian speakers native Italian speakers? it's not their second or third language. You know, which dialects are they speaking? Are the Urdu speakers, you know, which country are they from? Because there's a lot of regional complexity. And one of the things we found, you know, just making sure that we weren't offending community groups by getting, you know, speakers from a neighbouring country to do, you know, their video. So there was a lot of that kind of granular work to make sure that we were getting the spread of people from the community, from the right communities. Yeah, so there's a lot of that kind of detail.
Yeah.
So, yeah, and we work very closely with Matt Jasper and his team because to sort that out, to make sure that we had all of that detail before we even got to filming.
I think that's a really good point, Marianne, and just thinking about the scripting and how much we discussed that, and we did have our script reviewed by infectious diseases experts at Western Health and at CoHealth, and by GPs and by community groups and multicultural communications experts, even before it got to the talent and to be translated into various languages. And then you'd end up in big long email chains, sometimes talking about the detail of one or two words, and a lot of thought went into that. And then even once you start to release the videos, we picked up a couple of minor typos or errors in one of the videos, which we needed to fix really quickly and get the subtitles right, because I know that it's really important to have your language content easy to understand. And
it was three grammar errors in the Greek video, a missing full stop and 2 words missing, but we wanted to get it right. The other thing that we were conscious of, as Brendan mentioned earlier, is that we wanted to make a positive message because we knew that there was a lot of fear around, and we also had to future-proof it. So that's why we went with that script, because it was appealing to that commonality. It doesn't matter what language you speak, the reasons for getting vaccinated are to protect your loved ones and yourself, and so that we can get back to life. And so I think that script spoke to a lot of people. So the people that we kind of sense checked it with initially, and then once we got to that stage, we then sense checked it with the community volunteers to say, look, does this work for you? And people were very positive about saying, yes, we want to be part of this.
And I'm just conscious of time, so I'll just talk for a couple of minutes quickly about distribution, then we'll have time for a couple of questions maybe. But now the videos are out there in the world. They're available at nwmphn.org.au/goodbyecovid. And now we're going through a process of community outreach and digital targeting and PR to get these messages out there. So won't somebody please think of the comms people? Well, yes, us poor comms people at home in our warm houses contributing to the vaccination effort. But I know as a comms person who gets, you know, dozens of requests every day to share something, if it's not easy, I might not do it, or I might do it through gritted teeth. So we've tried to build a landing page that makes it really simple for people to share these messages. As we add them to various platforms, we're adding links to this page. So some of them are at the moment are only available on YouTube or to download via Vimeo, plus the scripts and links to resources in that language. But as we release them, we're uploading more and more links so that people just can quickly like and share. So through a multi-channel effort, we're trying to reach over 1 million people in our region. So there's like 1.6 million people in our region, so we're trying to reach a good proportion of them, and we're probably a quarter of the way there already. So we're probably going to go past that. So how are we doing this? Well, digital. I do a lot of hyperlocal digital targeting of people speaking various languages based on interests across multiple platforms, Google Ads, Facebook. Some of it's dark, so you don't see it unless you speak that language. Sorry, I mean dark social media. But We also use broadcast. So we've been lucky enough to have the videos featured on ABC News last week. We're also running these as community service announcements across Channel 31 TV in Melbourne and Geelong. They do a lot of shows for multicultural people and speakers of these languages, so we're running them there. Narrowcast, what do I mean by narrowcast? Well, social media is great, but a lot of people get information from closed groups, whether that's WeChat or WhatsApp or closed Facebook groups. So we're really working with all of the community leaders in the videos and also many, many, many more contacts to get these shared in emails and in WeChat groups. And this is kind of less sexy work. We don't see those views. We can't report on them, but it's really important to have these messages being produced by the community, but shared by the community where people will see them as well. We're doing a lot of PR. Twitter's great for this. So pinging peak bodies and politicians and other key stakeholders and thought leaders on those platforms who can help get it out there. And then community outreach, this is a big part of it. So it's not just digital videos. We're using these as ways to speak with our communities and to get in there and to not just help them share them, but you know, you'll see us popping up in various Zooms around the region, helping to work with community and share these messages. So I think that's about all from me. Please hit us up now with questions, or you can email us.
Thanks, Brendan and Marianne. That was a great presentation. I'm mindful of time because we've only got about 10 minutes left and we're going to throw to Ryan. Can I just say thank you as well for having a video that, excuse me, as a fainter that doesn't focus on needles into arms, because I can't say nothing would put me off further. And I don't know for all of you, I don't know if I should mention TV shows, but for any of you watching The Voice last night, there was this really alarming federal government ad that came on that my kids and I just went, oh my God, it was sort of, it's designed to scare people. And I think it's, I don't know, I just think there's a lot to be said about hope and the reasons why, like that kind of the back to the good things and the sort of campaigns that you're doing that we do that speak to actually why we want to get vaccinated without actually looking to terrify people at exactly the same time. So thank you so much for all of your work. I'm sure plenty of people on the call reach out to you after this as well. Being super mindful of time, I'm now going to throw to Ryan Shields. As I mentioned earlier, Ryan is the comms guru at VCOSS, led our work in our Back to the Good Things ad, as well as all of the other work that we've done throughout all of COVID in terms of, and along with everything else. So I'm going to hand over to Ryan for a bit of an update on what VCOSS is doing in this space, resources, etc. on offer. And Ryan, thank you, and over to you.
Thank you, Emma. I hope you can all hear me. I'm just going to stall for a moment while I share my screen, and then we can get into it. So give me some over-exaggerated nods, people, when you can see my screen. Excellent. Now, I've only got 7 or 8 minutes, so I'll jump through really quickly. We at VCOSS did run, and a couple of people have mentioned it, a Back to the Good Things campaign. I'll speak ever so briefly about that. I think one of the most interesting things, just coming off the back of Brendan and Marianne's really impressive presentation, is that they're actually very similar campaigns. And I see that as a really important positive because it means that the messages that we've all settled on independently are good and strong ones. And they're all, as Emma's indicated, quite positive and quite future focused. And what I'm going to talk about for the next couple of minutes will be our campaign and some of the resources and tools on our website, but also just a very short sort of 3-4 minute crash course in some message framing and positive messages, which sounds a bit boring and a bit jargony. I promise you it's interesting, and it's also really, really important, you know, especially as we go through the pointy end of this vaccination rollout. So just ever so briefly, I'm going to play to you our video. It's less than a minute, so we're going to play that, and then I'll come back and chat through it. I'm a big believer in show, don't tell, so hopefully you can hear this as we rip through it now. Hang on, here we go.
I'm looking forward to not worrying that my patients are going to die of COVID.
To no one else being separated from their mum in aged care.
I'm looking forward to our wedding and having our family and friends from overseas here with us.
I really want to see my mum.
I'm looking forward to being able to welcome guests without a mask on.
To having all the sports back to normal so that my family members can come and watch me play.
I look forward to performing in front of a big crowd again.
So please, get vaccinated.
Please get vaccinated.
Please get vaccinated.
Let's get back to the good things.
I ask you to get vaccinated.
For all of us.
Please get vaccinated.
So there we go. It's short and snappy, and it's a very simple message. And much like what Brendan and Marianne indicated, we didn't get caught in the weeds of go to this vaccination centre and check that website, because that's all going to change. Despite the best of intentions, that is a moving space. We kept with the basics. I want to flag, so I won't deal too much about how we produced that video, because it's a very similar story to what we've just heard. What I will flag is that video, as well as other resources, including what we've just seen from Northwest Melbourne PHN, is on our website. We've created a vaccine resource hub. I'll send this link around when we get after the meeting, but it's got, for instance, our video there for download, a link to the Goodbye COVID site, which you've just been stepped through, and a bunch of other things. So, you know, VCOSS is a member organisation. A lot of you on this meeting here today are our members, but we're going to be collating all of the different resources and tools that you might want to use from your sector colleagues and putting them in this one engagement hub. So if you're looking for some extra things to share, some extra way to amplify messages of your colleagues and people from across the sector, this is going to be the place to go to check, you know, what's available and to download them as well. So that's including printed resources and some audio resources. I'm actually a little bit embarrassed because we've got a stack of things to add to this site, which is sort of on this week's to-do list. So that will be a lot more vibrant as this week rolls on. Now, I'm just going to jump across. Again, I am conscious of time, but to my slide presentation. I hope you can all see that. And I've spoken through our video. I just want to speak for literally 2-3 minutes on messaging. We were really lucky after we released our Back to the Good Things campaign. An independent sort of data analytics marketing firm actually plucked it without our knowledge, and focus group tested it, which is phenomenal because we sort of never get the capacity to do that to our own things. It's just not something we do. So they lined it up against the Arts Victoria ad, as you can see on the far right there, and also 2 government ads. One, arm yourself, lots of needles going into arms, and the other one, that rather controversial ad of the woman hyperventilating and basically near death in a hospital bed. And to our amazement and great joy, they found that the Good Things campaign that we've produced actually came out as the most effective campaign. The message we produced was the most effective out of these 4. And dare I say, if the Northwest Melbourne PHN one was in this group, it would be up there as well, because it's that positive messaging which won the day. And the thing I also want to emphasise, it's not just positivity, it's also what we didn't say. And I'm not talking about the practicalities and the logistics, I'm talking about the negative. So I'm going to introduce you just to a basic concept in messaging here, and that is not negating the frame, as they call it. But what that means is, and here's a crystal clear example. I love American politics, so forgive my examples. Richard Nixon comes out and says, "I'm not a crook." First thing you think is, this guy's a crook, because he used the word. This is just from the last couple of days. This is manifestly not Saigon, referring to the evacuation in Kabul. Well, now all I'm thinking about are those images of Saigon and people getting into choppers en routes. If you say something in order to myth bust it, you're actually reinforcing it. People do this all the time with the best of intentions. There's a really good book for anyone who wants to dig it up called Don't Think of an Elephant. If I say don't think of an elephant, well, you're all thinking of elephants, aren't you? You know, and the visual here, this is Bob, he's not an elephant. Well, gee whiz, look, he is. If you say it, even to myth bust it, even to negate it, it's in your head. So why is this relevant to the vaccine rollout? Well, I've just made up some examples here. But if we wanted to run a campaign saying, why AstraZeneca won't give you blood clots, or vaccine deaths are highly unlikely, or more chance of dying from lightning strikes, or as Brendan said, you know, a shark attack. All you're thinking about now is blood clots, deaths, and lightning strikes hitting you as you walk down the street. Terrible things. So let's just not talk about those. Let's just not. Now, obviously, if I'm a GP and someone comes and asks me about risks and everything, that might be part of my response. But for us, for messaging, for a more public-facing campaign, let's focus on how AstraZeneca is saving lives, on, you know, the story of the mRNA vaccine, which is a fascinating, you know, marvel of modern science. Let's profile some of the doctors who are running this campaign, running the vaccine rollout. So we focus on the positives. And this, you know, time and time again in communications and messaging research is just shown to be more effective, and you're not doing your, you know, opponent's work, In political campaigning, you know, your opponent might literally be a person saying something you disagree with. In our case, it's misinformation, it's ignorance, sometimes it's fear. So let's not do the job of those forces for them. Very briefly, and Brendan touched on this, but I've got a little crystal clear example here. This is a coffee machine. Now, if I told you, you know, this is a great coffee machine because it's got 100 little holes poked in the bottom there, it can heat milk to 140 degrees and, you know, it can make 2 cups of coffee at once. You go, oh yeah, that's good. So what? If I told you it makes really, really bloody good coffee, well, that's great. You're more likely to be enthused by that and maybe to buy that machine. So what we're talking about here is not discussing the features of the coffee machine, but discussing the benefits. It doesn't matter what the features are. Yeah, we can get down to the detail if there are questions asked, but really what people care about are the benefits. So again, if we bring this back to vaccines and vaccine comms, you know, it's in our campaign, the good things. It's hugging your mum. It's going out to a musical theatre. It's playing sport with your friends. These are the benefits of a vaccine rollout. The when you get your jab and where and, you know, how many doses and how many weeks between are the features. They're important, but they're not going to sell it. What's going to sell it is the benefits we can derive from getting that jab. As Brendan said, it's a very personal choice and there's going to be lots of different benefits and different ways we pass and dice that. And the best we can tailor that, or the more we can tailor that, the better. But ultimately we want to be, and I'll wrap up here and throw back to you, Emma, but from my little stump speech, what we want to be doing is focusing on the positives, not reinforcing the arguments and the frames of our opponents. And we want to be focusing on the benefits over and above the features. I think as a group, as a collective, as a sector, if we do these things and do them well and do them in unison, we're really going to drive this vaccination campaign along. And that's only for the greater good. So I will share all the links after this event from all of our speakers, but including these ones I've referenced now and a few others. And I'll throw back to you, Emma, but thank you very much, everyone, for listening to my little bit.
A huge thank you, Ryan. And as mentioned, kudos to you for leading the Back to the Good Things campaign, and of course to the others who worked with us on that program, on that ad as well. So that's it for today. A huge thank you to all of the speakers who've contributed to today. I think it's been great to have the opportunity to get together. And I think also just finishing with those messages as well that Ryan and Brendan and Marianne spoke about around focusing on the positive and picking up in terms of Mel and Steve and looking at, you know, the amazing options that are out there now in terms of really lifting the options for people to get vaccinated and the ways in which we can make that easier for people, because that's what's really important. And it's, I think, on all of us and certainly on us at VCOSS to look at how we get those messages out there. We're going to send you a copy of this event fully captioned and transcribed, or it will be available on our website within a few days. So just give us a little bit of time to get it transcribed, etc. We will send you through the link. So a huge thank you to everyone who presented today, but also a huge thank you to everyone who attended. It's fantastic to spend time together, albeit virtually via Zoom. And look, hang in there. I know it's tough, and we do hope to see you in a few weeks, and we look forward to more and more in our community getting vaccinated, and hopefully to some more positive numbers as well. So take care, everyone. Have a wonderful day and hope to see you soon. Thank you.